In the movies, they are having one big contraction, then they grab that hospital bag and they head right into the hospital. But what do we really do in early labor? What is it going to look like? And what can you do to help labor progress or chill out if it's just kind of like a false start? Today, we're going to go through all of that. And I got to say, in my 20 years of labor and delivery nursing, this was done wrong so many times. So I'm really excited that you guys are here. Side note, this can actually be kind of scary to do at home. So I'm extra glad that you guys are here because it doesn't need to be that way. This video is sponsored by the online prenatal class for couples. It actually has a whole chapter on what to do in early labor. So if you're looking for more information on that, I'm going to put the link for it down below. Okay. Probably some of you are sitting there thinking, I don't get why this is such a big deal. Like, what is the big deal? You start contracting, you head into the hospital. But I'm here to first off say it's way more confusing than it sounds like. And in fact, even if your water broke can also be confusing. So a lot of this can really be like, is this the real thing? Because it can be really similar to what you've been feeling in the last few weeks. So again, I'm glad that you're here for more information on this time. It's something that not a lot of people talk about. And honestly, I think most people forget that this part even happens, except for us in the hospital who see you doing it the wrong way. The other thing is that early labor, the best spot for you to be in is at home. And that can be confusing because you, if you're following me here at the Pregnancy Nurse, have likely chosen to give birth inside a hospital. And so you're kind of hoping the hospital is going to manage all this labor stuff. But the reality is early labor is best at home, less likely to have interventions, more comfortable for you, even if it can be a little tricky or scary. So doing this at home with just you and your partner, can always invite your doula or your mom over as well, but it can be a little bit scary because you feel a little bit more alone. And the final part is that partners oftentimes hate this, right? They are like, great, we are going to pay this hospital an enormous amount of money to manage your labor, and they are going to take care of it. So if partners aren't prepared for this part, the fact that you're going to be at home for a few hours laboring together, if they don't have any idea what to do, this can be really overwhelming for them. And I got to say, my husband, who was like, I'm married to the pregnancy nurse, so I don't need to learn anything, always hated this part. He was worried he was going to end up delivering the baby. He saw me in a lot of pain, absolutely did not like that, didn't know what to do. So honestly, I wish I had trained him a little bit better because the pregnancy nurse knew what to do, but the pregnancy nurse husband, less so, was like, get in the car, we need to go. And I was like, oh, we need to pack a few more things. And he was like, go, we need to go. Anyway, you get the idea. It can be confusing for partners. So great one to send to your partner. Even better, join the online prenatal class for couples where they have that whole chapter to get you guys prepared for all of this together. And I think going through your birth plan and talking about how you're going to labor at home for a little bit can be really helpful. For this stage, it's really going to remind your partner that that part is even going to happen. So I actually have a whole free birth plan series that I'm going to link to down below that you guys can go through together. And it's going to give both of you an idea of what you can be doing at this time frame. Side note, this is actually a post on my website, Pulling Curls. I'm going to put the link for that post down below as well. Okay, the first thing to do in early labor, and it's just like what you'll do with a whiny toddler, is to ignore it. You want to just not think about it as much as is humanly possible. I know that when those contractions start to get going, your mind starts to race. And if you're not prepared for your upcoming birth, it may start to panic a little bit. Like, I'm not ready for this. What the heck is happening? Which is why I recommend a great birth class. Again, that one is linked down below. But the more you can sort of ignore that it's happening, the better off you're going to be. A lot of times I see people starting to count contractions. They're like, they're every 30 minutes apart. I'm like, girl, that's like 2 in an hour. Don't start timing them at that point in time. I recommend you hold off on timing the contractions until they're about 5 to 6 minutes apart. Prior to that, you can kind of wait. If you all really want to time, that's a great thing for your partner to do. Kind of gives them a job, which will help them feel more involved in the whole thing. But ignore it. And pro tip, if you can sleep, this is a great time to do it. Far too many people, again, are up counting those 2 contractions in an hour and not taking that time to sleep when things are still a little bit early on, when they could fill up that gas tank so that they'll have more energy once they get into labor. Other things you can do is nesting, getting meals ready for after you have your baby. The more you can just like kind of distract yourself from these contractions, the better off you're going to be. And I'm always a big fan of things that you can do that can, prep your life for after the baby. Getting your postpartum supplies all gathered up, packing your hospital bag if you still need to gather some things like that. I actually have a pro tip about this in the online prenatal class for couples that people absolutely hate, but it is something that I did and I recommend your partner do it with you anyway. watch the full class if you're interested in that one. The next thing to do is to call your provider. Like if you're feeling anxious or worried, or you just like a little bit of advice, providers frequently are answering questions about this, when they're on call. Now, it may not be your actual provider. As you can imagine, your actual provider could use a few 8 hours of sleep if this is like in the middle of the night. So a lot of times they'll have another provider that's on call for them. They might have a triage nurse that you can talk to. And I got to say, as a labor and delivery nurse, when people would call into labor and delivery, which by the way, we were not able to give any advice, but it really depends on your labor and delivery situation. One of my hospitals I could, this one I couldn't. I could really tell if people were in labor and were ready to come in or not by just kind of talking with them on the phone and talking about their stuff. So don't hesitate to talk with a triage nurse and get great information from them. Or it could be, some other answering service. So usually what you do is you'll call the regular number. They'll say there's an emergency line. So you call that line. Usually that goes to an answering service. And then that person puts a page into either triage nurse or whoever's on call for your doctor, or it could be your actual doctor. I do know providers who give patients in the last month their cell phone so that they can call them. Every situation is different. But talking it over with them about when you should go in, symptoms that you're seeing, symptoms that should require you to come in earlier, things like bleeding, those are things you're going to want to talk with your provider with. A lot of this, because bleeding can be not unusual during this stage, can be really disconcerting. And so that's someone you have that's on your side. Honestly, those providers would rather have that phone conversation with you rather than you come into labor and delivery and then they'd have to come see you or talk with a nurse about it. So don't be afraid to get in touch with them. That's what I'm here to say. I think a lot of people are worried that they're bothering them, but this happens very frequently for them. And the last tip that I have in early labor is to move. So if you are not asleep, and I'm talking actually asleep, not resting your eyes as I often do, but if you are not actually asleep, I would encourage you to move every 30 minutes or so. Now, this is a great one for your partner to get involved in. They can set the timer, remind, and help you to move because, girl, if you're in those last few weeks of pregnancy, it's hard to get up off the bed or change position. So they can be helping you move. They can be doing lots of things to help you, which can help them feel involved and like they have a place in this process, which they totally do. Just don't forget about them. Now, if you're like, Hillary, which way should I be moving? In the online prenatal class for couples, I actually have labor movement cards that are awesome for partners who might run out of ideas on helping you to move while you're in labor. So that can be a big help. Again, the link for that is down below. But if you're exhausted, it can be as much as just turning over in bed or adding some extra pillows or changing kind of how your pelvis is rotated. You got to remember the main reasons you're trying to move is to change how gravity is affecting baby and this pelvis and your uterus pushing down on the baby so that the baby can find their best way out. So moving different ways to change how your pelvis is can be really helpful. I actually have a whole post on the pregnancy nurse about curb walking. And I think the reason that it can be really helpful is because that's a different way to move your pelvis than we normally do in our lives. So again, that pelvis just feels a little bit wonky. Hopefully yours is not crocheted, but it just helps baby to find their best way out. So moving is a big key in early labor. And if you're nesting or making food, you're already doing that. One thing you can do is kind of have like a foot up on a step stool and kind of step up on that every once in a while. That can also help relieve some lower back pain as well. And like I said, I think you can really easily tie movement into ignoring it as well by moving and doing the things that need done around your house or at work as well. Now, early labor can come like a thief in the night. Like it can come and then go away and then come back. It's called prodromal labor, and I have a whole video of it. I'm going to post it above. It talks a little bit more about what to do if, labor just keeps starting and stopping, kind of like a false start scenario. So helpful. Be sure and watch that video. Thanks for joining us here on The Pregnancy Nurse, where we get you prepared, not scared, for your upcoming hospital birth and laboring at home, but not delivering at home. I don't know anything about that.